Hello, this is a video from the McGugan Library of Medicine, Evidence-Based Medicine Appraisal. We are now moving into the third step of practicing evidence-based medicine. The examples presented here will introduce you to the basic elements of appraisal for a therapy article. Evaluating the medical literature is a complex undertaking that will happen in stages throughout your career. You will find that the answers to the questions of validity may not always be clearly stated in the article, and that readers will have to make their own judgments about the importance of each question. You may need to consult with others, such as to determine whether the author's interpretation of data is sound. This section of appraisal focuses on the first question: are the results of the study valid? The issue of validity speaks to the truthfulness of the information. The validity criteria should be applied before an extensive analysis of the study data. If the study is not valid, the data may not be useful. Once you have determined that the study methodology is valid, you must examine the results and their applicability to the patient. Clinicians may have additional concerns, such as whether the study represented patients similar to their patients, whether the study covered the aspect of the problem that is most important to the patient, or whether the study suggested a clear and useful plan of action. There are different types of appraisal for different study types. These three questions are at the heart of appraising literature. This is a typical form that is used to appraise therapy studies. It asks questions that should be answered by authors and able to be found by readers. Note that there are different types of appraisals for each type of resource. Overall, we are asking, are the results of this study valid? The goal of this appraisal form is to help you critically review an article and organize what you read. These are not arbitrary appraisal questions. Appraisal is guided by standards surrounding clinical trials reporting. Standards for reporting clinical trials in publications are put forth by the CONSORT group, the Consolidated Standards of Reporting Trials, who are experts in clinical trial methodology, guideline development, biomedical journal editors, and research funders. In our next slide, we'll take a look at what the CONSORT reporting standards entail. CONSORT aims to alleviate the problems arising from inadequate reporting of randomized controlled trials. The checklist is used to make sure that authors reporting on trials do report the right kind of information so that their study can be appraised. This CONSORT checklist was filled out by authors of our example article. It is available with the full text of the article online. You may see this CONSORT guidelines chart included within other published articles. Here we can see several checklist items that appeared in our appraisal form. The evidence that supports the validity or truthfulness of the information is found primarily in the study methodology section. Here is where the investigators describe the setting for the study, randomization, interactions with participants, and procedures of other information specific to this project. A complete materials and methods section is necessary to provide meaningful results and discussion for the reader. You will refer to the materials and methods section throughout your appraisal. Now let's look at a demonstration of how the appraisal can be completed. You will continue to the tutorial 3B to see how to appraise an example of a therapy article using the critical review form for a therapy study. Available resources. The blank critical review form for therapy study and the completed form example have been uploaded to the Canvas site.